Right. Hello, everyone. Hi, my name is Anna-Maria. I'm from Healthwatch Bury. Welcome to this Facebook Live session. Today's session is about cervical cancer awareness, and we have Hannah and Alison as our guest speakers to explain more about cervical cancer screening program and symptoms to look out for. I'll just go through some live stream guidelines before we start the session. Number one, be accepting. Everyone is welcome to join the session, regardless of race, ethnicity, national origin, religious views, or anything else. Respect boundaries. Don't be rude. Don't flood the chat, so you're welcome to leave any questions that you might have to our guest speakers, and we will try and respond if we can, whether during the session or following the session. Don't self-promote, keep it clean. So the session overview today, I will do a quick introduction about Healthwatch Bury. Then we will pass over to our guest speakers, Alison and Hannah. And at the end of the session, we have questions and answers that are hosted by Steph, who's our volunteer. So who are we? Healthwatch is your health and social care champion. We are independent from the NHS and local council, and we make suggestions about the care improvements to local providers and commissioners. We also provide you with information and advice about local services. So the ways we can support you is signpost you to local online support groups, provide you with information and advice about you and your family members' healthcare, or listen to your experiences about local services. These are our contact details if you want to get in touch. I will now stop sharing my screen, and I will pass over to Hannah and Alison.
Hi, I'm Hannah, and
I'm Alison.
And we're from the Horizon PCN in Bury. We're just going to share a presentation with everyone about cervical cancer awareness.
Okay, so cervical cancer is a cancer that's found anywhere in the cervix, and the cervix is the opening between the vagina and the womb or the uterus. Nearly all cervical cancers are caused by an infection from certain types of human papillomavirus. It's also known as HPV. High-risk HPV can cause changes in the cervix, which could then develop into cancer. It can often be prevented by attending cervical screening tests. This aims to find and treat changes to the cells before they turn into cancer. Cervical cancer usually grows really slowly, and how serious it is depends on how big it is, if it is spread, and your general health.
Sorry, I can't see the presentation. Sorry to interrupt.
Oh, sorry, you can't see it?
No.
Can you see it now, or?
Yes, that's great, thank you.
All right, I'm sorry about that. So some of the symptoms to look out for cervical cancer are abnormal vaginal bleeding, so either during sex, between periods, or post-menopause, unusual vaginal discharge, pain or discomfort during sex, and unexplained lower back pain. There are many other conditions that can cause these symptoms, but you should let your doctor know if you are experiencing any of them.
Okay, what's HPV? So HPV is the name of a very common group of viruses. They don't cause any problems in most people, but some types can cause genital warts or cancer. HPV is spread by all types of sex, and that includes using sex toys. HPV has no symptoms, so you may not know that you have it. It's very common, and about 8 in 10 people will get HPV in their lifetimes. Cancers linked to high-risk HPV include cervical cancer, anal cancer, penile cancer, vulval cancer, vaginal cancer, and some types of head and neck cancer.
So there is a HPV vaccine. So girls and boys aged aged 12 to 13 years born after the 1st of September 2006 are offered the human papillomavirus HPV vaccine as part of the NHS vaccination programme. The HPV vaccine helps protect against cancers caused by HPV, including cervical cancer, some mouth and throat or head and neck cancers, some cancers of the anal and the genital areas. In England, girls and boys aged 12 to 13 years are routinely offered the first HPV vaccination when they're in school year 8. The second dose is offered 6 to 24 months after the first dose. The HPV vaccine protects against 9 types of HPV.
The cervical screening itself, it's a smear test, so it's either known as a cervical screening test or a smear test. They both mean the same thing. It checks the health of your cervix. It isn't a test for cancer, and it's a test to help prevent cancer. All women and people with a cervix aged between 25 and 64 should be invited by letter every 3 to 5 years. During the screening appointment, a small sample of cells will be taken from your cervix. The sample is checked for certain types of human papillomavirus that can cause changes to the cells of your cervix. These are called high-risk types of HPV. If these types of HPV are not found, you don't need any further tests. If these types of HPV are found, the sample is then checked for any changes in the cells of your cervix. These can then be treated before they get a chance to turn into cervical cancer. Results usually take about 2 to 6 weeks to come back.
So now we've got a list of some questions so frequently asked questions. So how long will my cervical screening appointment take?
Okay, the test itself, where your nurse or doctor takes a sample of your cells from your cervix, should only take a few minutes. You will still have time to ask any questions you want to ask before and after your appointment. Your nurse or doctor is there to support you with any concerns.
Can I take somebody with me to my appointment?
Yeah, you can. You'll be able to take a trusted person with you. If you need extra support or assistance, tell your GP surgery when you book your appointment, and they may allow someone to come with you.
I'm late for my cervical screening test. Will I develop changes or HPV?
A delay to your cervical screening appointment may cause anxiety, especially if you have had a HPV or cell changes in the past. It may help to know that HPV and cell changes can take many years to develop into cervical cancer, not months, and cervical cancer itself is rare. So while we can't be certain, it is unlikely that these would develop within the short time that your appointment is overdue.
How long do the results take?
As I say, you should get your results within about 4 to 6 weeks of your appointment. Your nurse or doctor should tell you when to expect your results after your appointment. If they don't, or you haven't had your results within the expected time, you can call your GP's surgery to ask when they might arrive.
I have symptoms of cervical cancer. What should I do?
Symptoms of cervical cancer include bleeding between periods, after sex and after menopause. Changes also to the vaginal discharge, pain, discomfort during or after sex, and unexplained lower back pain or pelvic pain. If you have any of these symptoms, it's important that you contact your GP's surgery by phone or online to get some advice.
Should I go for cervical screening if I'm pregnant?
It's usually recommended that you do not have cervical screening whilst you're pregnant or if you could be pregnant. Pregnancy can make the result of your test harder to interpret.
Does cervical screening hurt?
It might be a little bit uncomfortable when inserting the speculum. However, it shouldn't hurt. Remember, you can always ask for a smaller speculum.
Do I have to get undressed for the screening?
You will be asked to undress from the waist down and lie on an examination table. The nurse will provide you with a paper sheet to cover yourself. You can also wear a skirt, dress, or longer top.
So that's the end of the presentation. We do have a video to share. Sorry, I'm just trying to expand this. So I'll just get the video up, won't be a second.
Thank you, that's great.
Can you let us know if you can see that, Anne-Marie?
I can't see it yet. Will you be able to share your screen again, please?
There we are.
Can you see that now?
Yeah, that's great. Thank you.
Yep.
Brilliant.
Hi, so I just wanted to say, sort of within England, it's 3 to 5 years for cervical screening.
Oh, brilliant. Thank you. Thanks for sharing that video. That was really, really good. And thanks for the presentation as well. It was really informative, really, really good. And I found out so much more than, I already knew. So yeah, no, it was great. Thank you so much. I think our volunteer staff might have a couple of more questions for yourselves, if that's okay.
Yeah,
So
absolutely.
Steph.
Yeah, actually, that video had answered quite a few of my questions that I had, but I've just got a couple of them. So basically, if somebody was invited for cervical screening, but they lost the letter, how could they like make an appointment to attend the cervical screening?
Well, that's not a problem if you lose the letter. Just give your GP a ring. You don't need the letter when you have your cervical screen. Well, you don't need to bring the letter with you when you have the cervical screening. So just if you have been invited, give the GP a ring, or put a request in online, and they'll be able to arrange that for you.
And if somebody is diagnosed with cervical cancer through the screening program, what treatments are sort of available in order to treat that cancer?
Yeah, okay, so it depends on the type of cancer and the severity. So it will be discussed on a patient by patient basis. But some of the options available would be surgery, chemotherapy, and radiotherapy. But the treatment does depend on the type of cancer that you have, the type of cervical cancer you have, where it is, if it is spread, and also about your general health as well. So some patients, for example, wouldn't be suitable to have surgery, so then they would look at other options.
And obviously we screen people from being the age of 25, but there has been some cases where people under the ages of 25 have developed cervical cancer, but they don't qualify for like the cervical cancer screening because they're not within that age range. I'm just wondering why is it only 25 but we start screening people?
Yeah, so cervical cancer is very rare in women younger than 25, but changes in the cells of the cervix are quite common in this age group. These changes often return to normal and are less likely to develop into cancer, so screening them leads to unnecessary treatment and worry.
Right. So just one more question. I have a physical disability, cerebral palsy, and obviously I'm 30, so I qualify for the screening program. But a GP couldn't like form the screening, and obviously I've been told that because I'm disabled, that I shouldn't be having having screening, but I don't think that's really right, because you know I want to make sure that the cervix are healthy. So what advice could you give to like health professionals who are giving that sort of information out to other people with disabilities?
Yeah, everybody with a cervix, and this includes people who have decided to change their gender. Everybody who has a cervix needs to have that checked. So screening is imperative. As it said in the video and throughout the presentation, it actually picks up cells that are changing before they develop into cancer. So yeah, everybody must be having this cervical screening check. There are a few different options for people with disabilities. Your GP should be able to accommodate you. If not, then you can also request a home visit for that cervical screening to take place in your home. So somebody will come into your home and do that there. A lot of GP surgeries are disabled friendly, so able to accommodate people in wheelchairs, for example. They should also have hoists available to help get you onto an examination table. Failing that, then they can always be done within the hospital setting, where they will definitely have the apparatus and equipment that they need to get a patient onto an examination table to then perform that cervical smear test. So yes, absolutely everybody with a cervix, disabled or not, should be having the cervix checked every 3 to 5 years.
Thank you.
Thanks, sir.
That was brilliant. Thank you so much for your presentation. Have you got any other questions, Steph?
Well, it was just them sort of really questions, really, because like they answered a lot of my other questions were answered a lot in the video.
That's brilliant. That's great. Thank you. And thanks so much, Hannah and Alison, for coming along to our Facebook Live session today. It's been really, really useful, and it's really interesting to find out more about the screening program in England. So I'm gonna end on that note, and thank you, Steph, for your question and answer session as well. And thanks again.
Could we possibly just add that if any of your viewers have got any further questions that we haven't addressed, or if they want us to just go over something again, more than happy to answer those questions, you know, in the coming days if they want to.
Yeah, and we're going to share some useful links with you. Yeah. So, and just thanks for having us. I really appreciate it. It's really good to get the message out there, how important cervical screening is.
Oh, that's brilliant. Thank you. Thank you.
Thanks, Anne-Marie. Thanks, Steph.
Bye.
Bye.